Diagnosis and treatment planning for dental implants. Factors to be considered in selecting the prosthesis: span length, span configuration, abutment alignment, abutment condition, occlusion, periodontal condition, ridge form, general features, and financial conditions. Indications for implant treatment: severe morphological compromise of dental supporting areas that significantly undermine denture retention, poor oral muscular coordination, low tolerance of mucosal tissues, parafunctional habits leading to recurrent soreness and instability of prosthesis, active or hyperactive gag reflex, psychological inability to wear removable dentures, unfavorable location and number of potential abutments, single tooth loss to avoid involving adjacent teeth as abutments. Formulation of treatment plan will depend on the selection of proper biomaterial, biomechanics, surgical requirements, healing process, the type of prosthesis that is going to be selected, and the post-insertion maintenance phase. A surgical guide template is required to establish logical continuity between the planned restoration and the surgical phases. It is essential to use a transfer device. The ideal requirements of surgical templates: it should not be bulky, it should be transparent, should not be difficult to insert and remove, should be rigid, stable, and should enable proper angulation of implant placement. Should not obscure surrounding structures, must not contaminate the surrounding surgical field, and must be transparent. Should relate to ideal facial contour, should determine the amount of augmentation required for implant placement, and must permit re-sterilization when required. The surgical templates can be either fabricated with the help of CAD/CAM or stereolithographic procedures. Coming on to the types of bones, division A or abundant bone forms soon after the tooth is extracted with more than 5 mm of width, more than 10 to 13 mm of height, and more than 7 mm of length, and less than 30-degree angulation, and the crown implant ratio is less than 1. The treatment options are root form implants of diameter 4 mm and FP1, FP2, FP3 prosthesis is mandated. FP1 prosthesis can be given mandatorily. RP4 and RP5 requires osteoplasty because of limited height. Division B is barely sufficient bone, 2.5 to 5 mm width, more than 10 to 13 mm height, more than 12 mm length, less than 20-degree angulation. The crown implant ratio is less than 1. These are the various treatment options: osteoplasty and augmentation, and to convert it into division A bone or narrow implants can be placed with division B root form implants. Division C is compromised bone, unfavorable in width, height, length, and angulation is more than 30 degrees. The crown implant ratio is more than 1. The treatment options require osteoplasty that is C minus width. Augmentation procedures has to be done to provide a fixed prosthesis, and the aesthetics can be highly demanding. There will be more amount of force which will be transferred onto the underlying structures. Hence, you need to be thinking about other forms of implant placement like subperiosteal or transosteal implants. Division D is deficient bone, wherein there is severe atrophy, basal bone loss, that is flat maxilla, and pencil thin mandible. The treatment options include augmentation, which is the treatment of choice. You can go for root form or ramus frame implants or subperiosteal implants. The prosthodontic treatment options for implant classification according to MISH is FP1, which is a fixed prosthesis which replaces only crown, looks like a natural teeth. FP2 is a fixed prosthesis, replaces only the crown and a portion of the root. The crown contours appears normal in the occlusal half but is elongated or hyper contoured in the gingival half. FP3 is a fixed prosthesis that replaces missing crowns and gingival contours and portion of the edentulous side. The prosthesis mostly uses denture teeth and acrylic gingiva but may be porcelain to metal. RP4 is a removable prosthesis. Mostly it is an overdenture supported completely by implants. RP5 is a removable prosthesis wherein overdenture is supported both by the soft tissues and the implants.